Good afternoon, SLAE family. So happy to be here with you again on a wonderful Tuesday. And today we are blessed to have we're going to call her our resident medical expert now because we've asked her to come back. Many of you will remember Dr. Yvette Casey-Hunter. She's from the Ohio area, and she came and spoke with us when the Delta variant first came out. Well, obviously, we've all been very busy with the newest variant and how that's impacting our lives. And there's so many conflicting things that we are fed socially, through the media, through so many different systems. So we thought, you know what? Let's bring back the expert. Before I turn it over to her, Dr. Yvette Casey-Hunter is an amazing woman. She's been practicing medicine for, I think, 44 years now. Though she doesn't look like it for a second even. She's fabulous. She's also the Chief Medical Officer of WinMed Health. And as a matter of fact, before we start, if you could just take a few minutes and share a little bit about your professional background. So when we go through this conversation, they really realize what a true expert you are. I would ask if you don't mind doing that, please.
Okay, I'd be glad to. Thank you so much, Leanne, for this opportunity to share public health information with the public and with your audience. I really do appreciate it, and I don't take it lightly. I've been a pediatrician for over 40 years in practice in the Cincinnati area, having graduated from Howard College of Medicine in Washington, D.C., 4 years prior to that. And I've had the experience of seeing through a variety of practice venues, private practice, as well as group practice, single practice, and public practice now, the opportunity to see the progression of diseases and infections and prevention of infections and prevention of disabling and debilitating conditions due to vaccinations over the course of my career. So I really, this whole pandemic thing of COVID over the past 2 years has really been kind of a new experience for me in this venue, but it has been a tremendous learning curve for me. And I appreciate the opportunity to share what I've observed during that. I do not claim to be an infectious disease specialist in training. However, as a pediatrician, we deal with so many infections, we almost are.
Yes,
So,
in many ways you are. And it's really appropriate to have you here, not only because of your 40 plus years of experience and your position that you have right now, but that you do have a background in pediatrics. And we're going to talk a little bit about kids today in our conversation. Yeah. But first thing is I try to stay very optimistic in life. And certainly this has been wearing us out. This is the virus that will not leave. So we've gone through the original and Delta. Now we're on the next version, I guess technically number 3. But there is some good news. It is obviously highly infectious and it spreads, highly contagious, I'm sorry, and it spreads very quickly. But is there some good news? Are we finding it is a little bit less deadly? Can we find any hope in this latest variant?
Okay, there are some things that we can find to be hopeful for, okay?
Great.
Number one, it is a decrease in the fatality due to COVID in vaccinated individuals, okay? It's still a very deadly disease for people who are not vaccinated because they have no immunity whatsoever, no protection whatsoever. But in people who are vaccinated, there's less likelihood for hospitalizations or severity of disease. And for those that have been vaccinated and boosted, they have even less likelihood of showing manifestations of disease. We have to remember the disease is still out there. So when you come in contact with something, you can either contract it, become infected with it, and show a range of symptoms, or not be infected. So it's still there. It's still around us, but there is hope that things are improving. And with the increase in vaccination rates, I just participated in a federal webinar just this afternoon since we talked. And there's almost 8 million people now fully vaccinated in the United States, which is a tremendous improvement. And so, yes, this is extremely contagious, but there is hope for vaccinated people that there will be less and less impact on their lives. I was going to share 2 sets of statistics. Great. if it's your experience, if it's my experience, then it's anecdotal. But if somebody else shares the same sort of information, then it becomes much more impactful. So I do supervise the clinical staff in my organization. And in the past 8 weeks, we've had 20% of our people out due to COVID in the past 8 weeks. That's more than we had in the previous 2 years. Now, I just coincidentally, you know how things pop up on your screen on the internet when you're looking for something else. And there was a little pop-up and I looked and it was the Butler County Sheriff of Ohio, who stated that in the first year of COVID in 2020, they had 80 people out, 80 people, staff people out due to COVID. In 2021, they had 8. In January of 2022, they've already had 60 out.
Holy
due to
smokes. Wow.
So that's how fast this thing transmits. So people are coming down with it. It's around them all the time. And the hope is that it's going to be less fatal. And hopefully once we get beyond this one, hopefully there won't be too many more. But I'm thinking it's more like the flu. We're going to have to learn to live with it, but we do have to protect ourselves and more importantly, protect those that we love.
Yes, very much so. Now, one of the things that there's a lot of confusion around is isolation time when you quarantine yourself. So if somebody has this, there were certain timeframes and now we're hearing different timeframes and you hear 5 days and you hear 10 days. Can you help everybody with what the good guidelines would be for something like this?
Okay. Well, I think the original 10 days and 10 days to 2 weeks came out of the Delta variant, which was so very, very virulent. But now part of it is because there's so many people infected now. We just can't, quote unquote, have people out for 10 days, especially healthcare workers. So they start with healthcare workers and then industrial workers, that they could come back after 5 days if they were vaccinated, and 7 to 10 days if they weren't vaccinated. The issue becomes not so much the chronological date on the calendar, but rather how long are you symptomatic? Because as long as you're symptomatic, you're probably infectious and contagious, meaning you're going to be more likely to give it to somebody else that you come in contact with. So rather than look at a calendar date, it's more important to look at how many days are you without symptoms before you return to work, and should be 3 to 5 days before you return to work.
Okay, great. Now, one of the other shifts that has become apparent is that in the beginning, when we had the original first round of COVID, kids weren't really getting it that much. And now we're seeing children are getting it. Can you talk a little bit about children catching it, what the danger is to children, and just that whole context, because it's changed the dynamic of how people are handling schools and kids playing together? I think that would be really helpful, please.
Okay. Well, one thing we have to realize and remember that children are around other people all the time. They're around their parents, they're around their grandparents. And so a lot of times the danger is higher to the adults that they're around than to themselves. That being said, kids that have what I call chronic conditions, either hypertension, obesity, diabetes, neurological disorders, and autoimmune disorders, or oncologic, meaning cancerous processes going on, they're more likely to have more severe response to that infection than the average child. But what we have to remember, back in the day, we started giving flu vaccine to kids. And I said, why are we doing that? Not that many kids get the flu, or if they do, it's just a bad cold to them. And they said, we're immunizing the kids to protect the adults that are around them. We're immunizing the kids to protect their grandparents who could have a devastating case of the flu, et cetera. And in fact, locally, we had almost 12% of our teaching staff out from the public school system due to COVID, and they actually shut down the school system for 2 weeks, hoping to run it out so that then kids could come back. But we are currently able to vaccinate children from 5 years to 11 years and 12 years on up with the vaccines. And then they are working on getting the vaccine approved to vaccinate children under 5 years.
Wow. I
So
didn't know that was in progress.
hopefully, that's hot off the press today, that they're hoping that in the next few months, they'll be able to get it down lower, that age group.
Fantastic. Okay. Now I'm going to get into some of the things that I'm not looking to be controversial here, but these are the things people are struggling with. And since we have you here with all your experience, if you don't mind, there's a few things that I want to ask you to clarify. The first and probably hottest topic would be the topic of masks. Now, you know, depending on where you live, some places you go and you don't see a mask anywhere. And some places you go, you're not allowed in unless you have a mask on. Around the country, it's like different countries. So there's conversations about, I'm going to ask you a multiple part question. Sorry to do this to you, but there's the conversation about, are masks effective? There's the conversation of, okay, well, does it matter if it's a cloth mask or a surgical mask or the official, you know, mask that everybody's saying is the best mask? And then what about results that we're seeing too? So let's do the masks first. And then I want to ask you about, okay, how come in some states people say, look, everyone's wearing a mask, and in some states people say hardly anyone wears one, and they're seeing the same numbers, if that is true at all. So I think it's like a 5-part question. I'll help you if you forget any of that. Sorry.
Okay. Let's jump in on the mask, okay?
Yes.
So let's view the mask as a physical barrier between you and outside forces, okay?
Yes.
So, and what do I mean by outside forces? That means people breathing into the air, people coughing into the air, particles, you know. And so when you put a mask on, you're protecting yourself from exposure to other people's expirations and coughings and so forth and so on. But you're also shielding them from what you might have going on inside you that you may not yet be aware of. So that's kind of the rationale for using a mask. And I know early on with COVID, there were all these experiments that were demonstrated where people coughed and didn't have a mask on at dinner, and the spray went everywhere. So that's the theory about masks. Now let's think about mask as a filter, okay?
Okay.
So the difference between a cloth mask, a surgical mask, and a N95 or KN95 mask is the ability of it to filter out particles, okay? So forget about medicine, okay? Forget about this whole shebang. Let's think about something that we're probably all more familiar with, okay? So let's think about the filters we use in our kitchens, okay?
Okay.
So like if we cooking spaghetti, yum. We're cooking spaghetti, we don't want all that carbs all over the noodles left. So we want to pour that cooked spaghetti into a pan, into a colander, which has got a certain size holes, and then run the water over it, and it filters all that carbs, built up starch out, and then you have your nice spaghetti. You would not use the same filter, the same colander, to make yourself a nice cup of brewed loose leaf tea. If you did, you will have all of that loose leaf tea in your cup. So instead, you use a toddy or a tea filter specifically so that you can do it. And I recently tried to make ghee in my kitchen, and mercifully found the right size filter to use. So this is not something uncommon to us, but we don't think about it. So now let's apply that same model to the mask that we put on our face to prevent illness, okay? So think of the cloth mask as the colander. You know, you just need something to prevent big stuff from getting on you, you know? But if you want to really protect yourself from the viral particles, then you need to go to the surgical or the N95 mask. Now, I've had to recognize there's some people that are just so concerned about style and fashion. And for them, I tell, put on the surgical mask or the N95 and then put that lovely cloth mask that you ordered from who knows where over it. You know, they'll still see your face with the lovely fashion, but you will be protecting yourself in the long run from what's out there that you don't want inside you. So that's how I look at the mask. So hopefully
That's a
people
great
can kind of
analogy.
relate to that.
That's a fantastic analogy. And now it's funny because I'm thinking about when you talk about fashion, my local grocery store, the checkout girl has this one with bling bling all over it. It looks like a disco ball on her face.
Uh-huh.
I'm wondering, is she wearing anything underneath of that? That's kind of interesting. So those are the dynamics of the different ones. That is
Right.
very, very helpful. Now, the other part is you hear a lot of conversation. Okay, you look at Texas, you look at Florida, you know, they don't wear masks down there. Why aren't their numbers so much worse than, you know, New York or Boston or Baltimore or some of these other areas that are, you know, really heavily promoting and demanding masks being worn?
We need to think about several things. Okay, first of all, setting politics aside, okay, the East Coast and other areas of the country are much more densely populated. Per square, whatever you want to call it, per square mile or square footage or whatever, than Florida or Texas. And so they've got more open space. That may be part of it. You also have to think about everybody's not getting tested. I had some people tell me, I'm not going to get tested. I probably got it. I don't want to know for sure. No, you want to know for sure so that other people around you can be forewarned, you know, in case they might be at risk. So there's a lot of that. There's now the opportunity of people do home tests. So
Yes.
some people are opting to do home tests before they go to a family event. Well, they're not going to report the results. They're not required to report the results. But when we do a lab test through our lab, we have to report all positive results to the public health authorities. So underreporting has been notorious since COVID began because early on, people didn't have access to testing. And so you didn't get tested unless you were going to be admitted to the hospital ICU. So all along, there's been a vast underreporting of it. I have no doubt they got way more COVID in both of the, all over the United States than people are owning up to, because if they're not testing for it, then you don't know.
You brought up a lot of great points. I mean, I have a family from New York and they live on top of each other. So you can see where that would accelerate numbers versus a place like that. That makes a ton of sense. Even if you want to stop in one of the little areas just to pick up some groceries, everything is this big in New York and everyone's squished together in these tiny spaces. So with that,
and we have, not to cut you off, but we have centralized air and centralized heating. So in these buildings where you have lots of people living, they're all, the air is recirculated all the time. So if it's illness in one area, it's going to go to the next area. Just think about how chickenpox used to spread through the schools. One kid would get it, and within 3 or 4 weeks, everybody had it. Airborne. Yes. You know, so that's it.
I was one of those kids who caught it from somebody else. Absolutely. Now, when you were talking about this, you mentioned testing being available, and I believe it was the U.S. Post Office that was giving out free tests. Can you talk about that, please?
Okay. Yes, the federal government is trying now to make sure that people have access to testing, self-testing. Okay. So they're making available free. They were getting them in the public libraries. I know that the commercial pharmacies are selling them and so forth, and they're going off the shelves like hotcakes. So, but there is that available. And my sister was just telling me the other day, there's a place we can apply to that they'll send us 4 test kits per family. So that they're trying to get it out there. They can distinguish. The main thing is with the Omicron, people don't know if they got allergies or they got COVID, because some of the symptoms overlap. And so a way to know is to be able to get a quick test done. And that's what they're trying to do, get it out there for everybody. And the concept is caught on. So the demand is high for these test kits.
Yeah, there was a link that was going around for USPS, and you could go and they would send you for
Mhm.
free tests to the address you have. We'll actually post all that. I think that would be really helpful.
Yes,
Okay,
that
now
would be.
I'm gonna dive deep, and it's very interesting because I have friends on both sides of this conversation. You know, I
Mhm.
have some friends that are fully masked, vaccinated, boosted, really, really, really careful. And then I have some friends who are like, you know what, this is crazy. It's diluted herd immunity. You know, you got to let people do what they're going to do. Let's talk about this because I'm not even going there. I'm not a doctor. Herd immunity. Is it real? Is it nonsense? What are your thoughts on that whole concept?
Okay. Let me tell you, herd immunity only works if the whole herd is vaccinated. Okay.
Mhm.
So a quick throwback. We used to get smallpox vaccinations. That was the thing that put the ugly scar on your arm, and my dad tapped it behind my shoulder so nobody would see it unless they were really looking for it. Once we eliminated smallpox in this country, then nobody had to get it because there were some people who had unfortunate adverse reactions to the smallpox vaccination. Same thing with polio. We got so many people immunized against polio. We eliminated polio in this country. Now, no, we can go to a less strong form of polio vaccination just to keep the immunity up in the community. Okay.
Mhm.
But let's kind of talk about the difference between preventive response to a vaccination and a protective response. Okay.
Yes.
So preventive response is, I got this vaccine. I do not expect to ever come down with the symptoms of this disease, even though I may be in contact with it.
Mhm.
So like chickenpox vaccine, measles vaccine, most of the time people don't get those diseases in any kind of shape, way, or form unless they weren't immunized or there's something else going on within them. But in general, people don't get it. But people take the flu shot, and every year people still get the flu. That's because that vaccine, and like COVID, it's a protective but not preventive
Mhm.
vaccine. So protective means if I come down with COVID, I'm going to have less symptomatology, less severity, less prone to be hospitalized or to die of it than somebody who has not been vaccinated. So think of it this way: a vaccination, it kind of sensitizes your body to, this is a foreign thing that does not belong in me. I'm going to make antibodies to it so I can fight it off. So the next time you get exposed to it in what we call in the wild, meaning in the community,
Mhm.
your body already has some built-in defenses and can try to fight it off. So I like to make things very easy for people to understand, because sometimes the whole medical jargon just kind of loses people. So if I can digress and give a little bit of a different example, maybe
That would
this
be
will
great
work.
because your pasta and tea thing made complete sense to me. So let's go down that road.
Okay. So let's say that you're looking out your window and it is raining badly. And the second you step out that door, you are going to get drenched. Okay.
Yes.
So you want less drenching. So you put on a raincoat.
Mhm.
And then you think about it, man, it is really pouring out there. This is no light drizzle. It is pouring. I am going to take my umbrella and open it up and cover myself with it. And then, man, look at that water puddling out there. Oh, man, I really don't want my feet getting wet. I really want to protect myself as much as I can. So I put my boots on. And then I go out with my raincoat, my boots, and my umbrella. Okay.
Mhm.
So let's look at the raincoat is the first shot in a COVID series.
Okay.
Either it's the first of the Johnson & Johnson, or it's the first of the Pfizer or the Moderna. Let's think of that open umbrella as the second shot in the series for Pfizer and Moderna. And let's think of the boots as the booster for those. And now Johnson & Johnson is that we need a booster also. So that way you're protecting yourself as much as you can. When you go outside in the rain, you're not going to get wet. Okay.
Yes.
Now, little Johnny sees it's raining out there, but he was in a hurry to jump on that bus and he forgot his umbrella at the door of his home.
Mhm.
So he gets ready to get off the school bus and all the other kids have their umbrella. And you know, like kids are so congenial. They say, oh, I don't want you to get wet, Johnny. Come on under my umbrella. Come on under my umbrella. And so they all crowded around Johnny trying to protect him, because you know how when you try to share an umbrella, some of the drips still come down your neck, you know?
Yes, of
But
course.
then they're going, and then the teacher says, hurry up, kids. You got 2 minutes to get in the school building. And they all take off running, and poor Johnny is out there getting drenched because he doesn't have an umbrella. That's the equivalent of herd immunity. It's okay as long as everybody around you is protected. You're protected. But once somebody else is around you that is not protected, you are no longer protected, because the virus can only be carried by people who are not vaccinated. The virus resides in people who are not vaccinated. So just think of it that way. So if you really want to protect yourself, you have to do it completely.
That was an amazing analogy that makes so much sense. And I also, backing up, really like the distinction you made between protective and preventive vaccinations, because a lot of people will discount the vaccination saying, well, people are still getting it anyway. And that's a really critical distinction. Well, I am so grateful you're here. I do know you have a conference call that you need to jump on, but for everyone who's watching this, two quick things. Dr. Hunter is in the Facebook group. If you're watching this on Facebook, she is going to be jumping onto a Zoom meeting she has right now for the medical industry, but she's going to be checking back in the comments. So if you want to post any questions, she's generously offered later tonight, she'll come back in the group and go ahead and post comments. If you end up watching this a little bit later and you're seeing this on YouTube, you can leave comments on YouTube as well. But I so appreciate your time and your wisdom and your experience and the analogies to make it sense for all of us who are not in the medical field.
Well, thank you so much, Leanne, for this opportunity to share this perspective. I'm always open to sharing things on a public health basis, because people take in information all the time, and we're getting a lot of stuff online as it is. We want to have the best information out there possible. So I thank you for this.
Oh, I thank you, because there's so much. I mean, you can click on the internet and see 10 different theories in 1 minute. It's amazing how much and everywhere we go, we're hearing it. So it's really wild. And having your experience and having you be a CMO, this is phenomenal. So thank you again.
Thank you. As I said in the first time, we don't get a do-over. So we want to make sure we get it right, that we do the most we can to protect ourselves and those we love, because regret is something we don't want to live with.
Yes. And oftentimes people aren't worried about them getting it, but it is the older relatives or people who have underlying health concerns that we're around that can be impacted.
Absolutely.
Excellent. And we have two quick announcements before we wrap up today. Number one, if you are not aware, we are slowly and steadily loading a lot of the past interviews onto a YouTube channel. So if you would like to go back and see any of them, share any of them, or you've missed some, or you're curious, you can go to YouTube and look up SLAE with Leanne Gabriel. And you can even go by categories. You can pick just the nonprofits, or things about health, or things about being an entrepreneur. And we finally got ourselves a little Instagram as well, an Instagram account. So you can go on there and we announce who's coming the upcoming week. And then just before we depart, since this is such an incredibly important but heavy topic, we're going to have a little fun next week. And next Tuesday, we are going to have a really wild woman. She's a motivational speaker professionally, but she's also a professional singer. And she has managed to hit the accomplishment of singing the national anthem at events in every single state in the country. So she will be a wild, exciting, and inspiring story. So we'll go a little light after doing something this important but this heavy. We'll see you all next Tuesday. Thank you so much for being here. Take care, everyone. And thank you again.
Bye-bye.